Good afternoon. We continue with the vision of future of health with Emmanuel Fombu, medical futurist and the bestseller author of The Future of Healthcare, Automation Partnering for Better Outcomes. Emmanuel will present his vision on how COVID-19 will transform the industry and how we will critically react to measures taken by the different countries and organizations. Hi, Emmanuel.
Hi, Stanka. Thanks for having me.
Thank you for being with us today, and I'm looking forward to meeting you after this pandemic is over at Future of Health Live Summit in Bratislava. In the meantime, I'm glad you can join us virtually. Hi, Emmanuel. In your book, The Future of Healthcare, Humans and Machines Partnering for the Better Outcomes, you gave a vision on how even the healthcare will look like utilizing the technology, especially digital tools. Will COVID-19 pandemic speed up digitalization of the healthcare systems?
Yes, it will. Certainly will. And we have seen that already happening, right? So if you look at things like telemedicine, last year when we were in Bratislava, right, for this same conference, and we had conversations about the concept of remote patient monitoring, we thought it was futuristic, like 20 years away, right? You talk about the concept of telemedicine. There was a lot of conversation even last year, even earlier this year, even 2 months ago, about the fact that this is something that people will not adapt. It was difficult for people to use technologies. But today, especially in the US now, and I'm sure everywhere else in the world, you have everyone literally going into telemedicine. If you have diabetes or heart failure or cancer or any of this, or any comorbid conditions, you are extremely at high risk of dying from being infected with some COVID-19. And so people are staying away from hospitals, right? Hospitals don't have enough beds, so they don't have time for people to be crowding the emergency rooms for typical things like heart attacks or other conditions. So people are reaching out, to talk to doctors or nurses through like telecommunication, just like I'm talking to you now, right? It's become the norm. Every single meeting now is happening through technology like this. And so even if you look at it from the perspective of even conferences, right? If you told anyone probably 2 months ago that they will spend time actually attending congresses using Zoom, they would probably tell you no, it's not possible. But every single meeting right now is taking place virtually. So it's definitely exponentially hastened the adoption of these technologies. And more interestingly, also, if you look in the US, especially where before, if I was a patient talking to you, Stanka, like Dr. Stanka, I was talking to you, and I get reimbursed at a lower rate, right? So which means I get less money. And if I saw the doctor in person, the doctor gets my money. And so there was not the incentive for clinicians to actually adopt telemedicine. But today the regulations have changed where doctors get reimbursed at the same rate through televisits and the same rate if they see someone face to face. So you see a fast adoption in that particular direction. And if you look at the stock market, the Teledoc, for example, one of the first companies in telemedicine that went public, the stock has been skyrocketing, right? It's keep climbing higher and higher. So it's great.
What other areas of the healthcare will be digitalized first from your point of view? If, of course, we're talking right now about the telemedicine.
Correct. Another great area that in our industry that's going to change, look at clinical trials. It's another interesting area. Multiple companies, from Novartis to Roche, GSK and everyone else, or the big players and other small players, everyone is having problems with their clinical trials now, right? If you had a clinical study in which you required someone to do hospital visits, that is completely disrupted today, right? Because patients cannot show up, for these visits, and they're scared to go to the hospital. And so it's a completely different way of thinking where you see virtual clinical trials taken up, right? Which is something that used to be a luxury, but now that's the way going forward. So clinical trial space is a very interesting piece. And now, I've talked to friends and I'm still in the industry, and you see a lot of clinical trials getting protocol amendments to adapt to the new world. And I think going forward, every single trial that happens will have, we'll try as much as possible to have less physical touch points with the patient. It'll be a lot more remotely. That's one element of it. If you look at the element of quality of life measurements, which we do quite a bit using wearables, right? So imagine you're running a clinical study and you want to show that your drug improves quality of life. The only way you could do that now is to ask through questionnaires, and those questionnaires usually ask questions like, hey, were you active the last 2 days? Did you walk your dog? Were you jogging? How many steps did you walk? But now we're all virtual prisoners now in our own homes, right? We're not allowed to go outside, right? And so if you had a study going on and in a high-risk patient population that is sick, and that patient, they go outside, they have the risk of dying, you think they'll go outside? No, they're not going outside, so they stay inside. So it redefines how we measure quality of life, right? And that's one aspect of it. Mental health issues are also going up on the rise, especially. So if you look at mental well-being of people and you run a clinical study today, that affects how people feel, right? And so that'll definitely skew every single trial that's happening right now. And so a lot of companies have put a lot of clinical trials on hold, and they're amending protocols, and be a completely different way of looking at that.
Right, so you're right. How already digitalized areas of the healthcare systems are helping to fight COVID-19 from your point of view?
Correct. So this is, to me, I mean, COVID-19 is a bad thing, but it's a blessing for digital health people, right? I mean, we've been talking about digital health and having digital health conversations for a long time. And this is finally a moment to be on the spotlight, right? Because everyone, no one has a choice now, right? We are not the stepchild anymore, right? We are at the center of everyone's life today, right? So it's not another option. This is the way life is, and this is what everyone must do, right? So whether you're resistant to change or not, you must adopt. So a key point in which, if you talk about COVID-19 in general, one of the key questions you hear is, when do we go back to normal, right? I mean, that's a normal life. So we had a conversation, and you mentioned you hope to have this conference in October, and I hope it is. We'll go meet in person, correct, then, right? So I think it'll be fantastic.
In October.
Correct. And so the question becomes now around, okay, so how do we get back to normal? Well, we'll get back to normal by either a couple of things. One is if we have a vaccine, right, which will not be available by October or November, right? So we're looking at 12 to 18 months from now, right, if a study works, to have a vaccine. So that's what's going to happen. In the short term, what are we going to do different? We have to do testing, right? So if you do antibody testing, it tells you about people that are actively positive for disease. That's one element. And then if we do antibody testing, just say, hey, you were exposed to the virus, but you didn't have symptoms, or you're asymptomatic carrier that recovered, then it could be one category, right? And then the other category is idea of contact tracing, which is all based on digital health. The idea that you could walk up to someone and be close to them, and then you get infected, or you find out you have symptoms down the road, and then we could go back and see where you are based on a GPS location tracker on your phone or any device you have, and then contact those people to actually notify them so they can be quarantined to stop the spread of disease, is all based on digital health. And so in a very interesting side of things, where Google and Apple, literally the manufacturers of most of the devices that we use, from the iPhone right to Android devices, have formed a partnership to actually help with contact tracing. And so that's what is happening in this particular direction. With that being said, it's also very interesting, for us to start redefining what exactly health data is, right? I mean, what is health data, and who has access to health data? And the question of privacy becomes a completely different element, right? Because even though it's fun and it's great, we could do this tracing, but remember, the government is getting its hands onto our data sets, right? And not just tracking you now, but now your body temperature becomes relevant to the government, right? And the best way to do these things is doing through remote monitoring, right? And so it's a very interesting element from the regulatory side, privacy side, and from the innovative side.
Obviously, we were not prepared for these pandemics. Where did we fail?
Well, we failed on everything because we don't have this concept of something I argue for a lot, which is a concept called predictive medicine, right? I think I talked about this last year in Bratislava, and no one's probably listening to me, right? And people are like, oh yeah, whatever, that's futuristic, robots and whatever, and AI and whatever it is. But the whole idea, correct, right? If you look at it from a perspective, I think what this has done is this idea of being proactive in healthcare, right? If you talked about wellness and disease, we always ignored wellness and we focused on, you have a disease, here's a drug. From an industry perspective, this is what we did, right? So if you have diabetes, we want to manage your diabetes, right? If you have heart failure, we want to manage it. It wasn't a high priority element, right? So if you have digital therapeutic company for diabetes, then people are like, well, it's an extra luxury, send me alerts, maybe I change my diet or not. But what COVID-19 has done has shown that people with comorbid conditions are those dying from the disease. I'm in New York City right now, in New York, which is the epicenter of this infection, right? I mean, I'm living in the middle of this, right? So that's my day-to-day life. And what you find out is majority of patients that are dying from it are patients that are elderly and those that have comorbid conditions, especially diabetes, right? So what does that mean going forward? Going forward, that means that we should live healthier lives. We need to start campaigning for that. It's beyond COVID-19, right? We want to be healthier going forward so we could prevent things from happening. And the same exact thing that happened with us being lackadaisical or being lazy about putting efforts into prevention of diabetes and heart failure and cardiovascular disease, the same kind of attitude we had towards the prevention of pandemics. Because imagine if we went to someone and said, hey, can I get a check for $1 billion to stop the future pandemic? They'll think you're crazy, right? But now it's happened. And now we've lost trillions of dollars that countries have lost and industries have lost. People are unemployed. So now people realize what happens. So now it makes sense from a cost-benefit analysis to prevent the next pandemic, right? So you see the field of public health, the field of infectious disease becoming more prominent. But I think that the mindset of us using technologies to engage users, I don't like to say patients, users, because I think we're all patients at some point, but engaging users to be proactive and live the best quality of life for themselves, I think that's the way to go forward. Sorry, I talked too much.
Yes. What should we learn from this pandemic? What should we, or how should we transform the healthcare to tackle the next pandemic better?
Correct. So we need to realize that one, we are, as humans, as humanity, that we live in a global world and we are connected in one way or the other. It's not just Europeans and then the Americans and then the Asians. People travel, planes travel, right? And so if we look out for the best interests of each one of us, that we could definitely actually have better outcomes, right? Things that happen in countries that don't only stay in those countries, they could affect other places. So we have to have a global mindset on how we do things in general. The next level of it is when we have our backs against the wall, we actually become innovative, right? And so in this particular case, when the world gets shut down, guess what happens? Now people think it's okay to go on concerts on Instagram, right? People are, having meetings, virtual meetings are okay. Working from home is okay, right? Things that people did not think were possible before. And so these things are happening. So I think if anything we've learned from this is we need to understand that we are well equipped. We have the right technologies today to dramatically change the way we engage with each other and how we do business in general and how we look at healthcare. So we need to have that open mind and explore and see what the future brings. I think it'll be a lot of fun.
As I know so far, you have been helping out at the hospitals. How is the actual situation in New York?
Pretty bad, especially when it comes to healthcare workers, right? So first off, when this thing started coming, everyone thought it was a distant issue, right? It was, oh, it's a China issue. And then the next time anyone took it serious was when it actually hit Italy and Spain, and we saw the numbers coming out of that became really serious. Here in the US at the time, even at that point, there was a shortage of doctors. One, so healthcare providers were short, they were not available to work all these long shifts. That's one. Two, because so many people were getting sick and there was no lockdown, hospitals were getting flooded. And so there was a lot of burden on healthcare workers, right, to handle all this traffic of what is happening. And the stress of people showing up over and over again and working long shifts and watching people die on a regular basis. I'm in New York City. I'm in New York now, and in the city you have refrigerators and morgues on the streets, right, to put bodies in. So imagine walking through the city and you're seeing this on the street. You have a Navy ship on the Hudson, as open as a hospital. The convention center is a big hospital. The entire city is dead. If you live in the city, you're kind of quarantined. So I can't leave and go anywhere, right? If I leave New York, I can go out to other states, right? I have to go lock myself for 14 days. So I'm kind of stuck here, like in this particular zone. And so, and looking at the toll this is taking on people. Just yesterday, the head of emergency medicine at the Weill Cornell New York Presbyterian Hospital in New York committed suicide, right, down in Virginia, which reason her parents. We have another neurosurgeon that committed suicide. So the suicide rates are actually going up in a lot of people. Many people cannot actually handle the change that is happening. It's very distant. People are losing their jobs. So mental health is actually becoming a much severe issue that is happening. People that have comorbid conditions are being extremely anxious. At the same time, before there was a feeling that young people cannot get infected with this, right? So young people were kind of immune to this. So if you look in Florida, people were going on spring break and partying and having a good time. But now you have cases of young people dying from this, right? So there's a sense of fear and anxiety amongst people overall, but we can't wait to get back to normal, right? Whatever the new normal is. That'd be an interesting piece.
Yeah, we are all in this together, and all of us are hoping that situation will get better soon. Are you?
In Bratislava, you guys have more space in Bratislava. You know, you could go out walking, but at Danube, you know, here in New York, it's all congested, right? So you can't. It's better.
Yeah, right. Are you planning to write a book about the current situation and takeaway?
Actually, yes, I am. I'm actually writing 2 books right now. I'm writing a book about the world post COVID-19. So that's almost done. In more of a business strategy, how to think about prevention going forward and what the future healthcare will look like post COVID-19. So so I'm actually working on that book, and I've also been co-hosting a radio show in New York City on Hot 97. It's a hip hop radio station. And it's interesting because I get to speak to people from the urban population, a lot of African Americans and Hispanics within New York City, and having a conversation with them about predictive medicine and healthcare. And my goal through that platform, which I really like, is connecting my medical background and my time in industry to the average consumer to explain to them what we are trying to do with these technologies. Because every time we go to these conferences and we spend time, most of my time I spend with other experts in the space, right? People that understand digital health. But when you see something like COVID-19 killing people in a large scale, especially for minority communities, and I had this opportunity to talk to them. So I'm being an advocate for that. So I'm writing a second book with the Fox News reporter and host of Hot 97, Street Soldiers, Lisa Evers. So we are writing a second book about what it was like going through COVID-19 in New York City, right? So that keeps me busy enough for now. Let's see what happens.
You're so busy, right? I can say for all of us from Future of Health, so we are looking forward to your new book. Really, thank you so much for being today with us. And Emmanuel, stay safe and hopefully see you soon.
Thank you very much. And thanks for having me.